Hello, good evening. Hello, can you hear me? Sir Ariel? Magandang
Opo.
gabi. Yes. Uh, Miss Maricar, are we still going to wait for some other students? Hello po. Anyway, okay, so let's start, Sir Ariel. Hi, good evening. So I'll start to introduce first myself. I'm your medical coder facilitator or instructor for this subject. I'm Mark de Guzman. So I'm a certified professional coder and okay. And I took my CPC exam here in UAE. So currently I'm working as a medical records clerk in a home care facility. So in a way, yung napag-aralan ko from the CPC exam is related dun sa napasukan ko na trabaho. Although I wasn't able to secure a medical coding job per se, I was able naman to use that credential to land me on a different job. So with regards to the medical coding, my practice in the Philippines is related for that particular profession also because I used to work at PhilHealth in a private hospital. So I was the insurance and billing clerk of a private hospital in the province. Hence, my knowledge and my practice in using medical terminologies and the codes for the diagnosis as well as the surgical codes is na-apply ko for the CPC exam or medical coding exam. If I may just ask Ariel, what's your background? Do you have any medical coding experience or medical knowledge? Your bachelor's degree, is it related?
Wala po. High school
Oh,
graduate po.
okay. So totally parang fresh or will try a new course or path para sa pagkuha mo ng CPC exam. I'll just wait because I need to share the screen and naka-disable ata. Okay. Yan. Okay, ma'am. Thank you. So for the level one, we have 6 weeks to discuss anything about the medical coding profession as well as yung mga basic knowledge that you need to acquire and develop for you to successfully pass the coding certification exams. So for me, as I have said earlier, I took the CPC exam. So CPC, which means for a Certified Professional Coder, is given by AAPC. So all over the world, there are only two institutions that gives you the certification to become a medical coder. One is AAPC, which the one I took here last year, July. So yung membership ko, due na for renewal this year. And you have AHIMA. So all the information that I will be presenting to you can be found on their websites if you want relevant or further reading. So in this level, for this course that we are offering for level one, these are the goals or objectives that we need to achieve. So for week one, you need to have an understanding of what does a medical coder do, what is the medical coding, and how does it fits in the healthcare system. And kasama dyan, syempre, what will be your roles and responsibilities, especially if you're going to secure a job already, working in the hospital, in clinics, or like me, sa mga home care setting. Kasi dito sa UAE, dyan naman madaming nag-hire, especially sa mga insurance nila because that's really the work of a medical coder. Uh, for you, for the company to secure the payment from the insurance by codings. And what are the different qualities as well as the opportunities that you can get by this course and being a medical coder. So at week 1, our topic would be the introduction for medical coding. But for all the level 1, which is comprised of 6 weeks, so ito yung mga ibang topics. So for week 2, we will tackle about the basic medical terminology since you are not attuned with medical terminologies, you do not have the medical degrees. So maybe yung mga napag-aralan lang sa science, yung elementary and high school about the body parts, name of the different systems in the body, that would help you. But in medical coding kasi mahalaga na maintindihan mo din talaga kung ano yung mga pangalan ng disease, especially kapag medical terminologies na, as well as yung mga specific na tawag sa bawat parte ng katawan natin. So we will teach you that in understanding and how to compose or how to translate, interpret your basic medical vocabulary. We will also study about the cell, the body systems, its different parts, and as well as the different diseases that can affect each system. So for week 3, ayan, magfo-focus na tayo sa mga per system or per body organs as well as the disease. So for week 3, it's all about the skin or the integumentary system, skeletal system, it's all about the bones, and the muscular system, so muscles. So we're just discussing this para at least meron kang expectation, saka pwede ka din magbasa-basa in advance. Browse ka sa Google, sa internet, ng mga resources. On week 4, we'll be talking about the heart and the blood. So that's the cardiovascular system. Respiratory system, something to do with your lungs, your breathing, oxygen and carbon dioxide cycle, as well as your lymphatic and immune system. So this is all about the blood and the parts of the blood that fights off the viruses, bacteria, and makes you stronger. Week 5, we'll be talking about your digestive system. Of course, it's all about the food, nutrition, the urinary system, and your reproductive system. Also, on the last week, to end up, to complete the cycle, we will be talking about your nervous system. Kasama dyan yung brain, spinal cord, and your nerves. And also, you have your endocrine system and your special senses like your eyes and ears. So, madami tayong aaralin. Pero, syempre, for any other medical professions, they had 4 years or more in studying this particular subject, especially anatomy and physiology, medical terminology. So, medyo bihasa na sila or mas madaling intindihin or mas madaling or mas magiging comfortable ka kung nagkaroon ka din ng ganong training during college or during in your high school days. But, of course, ang priority naman natin is to help you to get your certification para magkaroon ka ng other opportunities for work. So, for this course, we'll just base our training and our discussion on mga basic and fundamentals para kumbaga para lang matrain ka na magkaroon ka ng skills on how to come up with your own strength in determining the meaning and identifying body parts. Okay, so ano ba ang medical coding? Pag sinabi mong medical coding, this is the process na yung mga information about the patient, hospitalization, consultation, anything that relates to the condition of the patient. Bakit ka nagpa-hospital? Bakit ka kumonsulta sa doktor? Anong nangyari sa'yo sa clinic? So instead na you put it in a narrative, mga sentences or medical records, you will just input it or encode it using numbers and letters. So you will translate yung mga mahahabang nakasulat or nakaprint sa papel na sinabi ng doktor, ng nurses, at kung sino pang nag-alaga sa pasyente or nakaharap ng pasyente during the consultation and hospitalization para yung system is ma-convert siya sa understandable codes using letters and numbers all over the world. So for example, nagkasakit ka, na-hospital ka, ang naging diagnosis mo, sinabi nila, ikaw ay may diarrhea or tinatawag nating acute gastroenteritis. So kung na-confine ka sa UAE, pag translate nila yan sa codes, maiintindihan yan sa Pilipinas, maiintindihan yan sa Amerika, or sa kahit saang parte ng mundo na kaya ka pumunta sa ospital or kaya ka na-confine sa ospital dahil ikaw ay merong tinatawag na acute gastroenteritis. And you don't have to use the medical term acute gastroenteritis. In the system, it will just appear something like letter A, 0.9. So, yun ang medical coding. At bakit natin ginagawa ang medical coding? Para mas simplify and mas standardize yung understanding ng healthcare setting. Especially, we're focused on the insurance. So whatever the doctor writes, whatever the laboratory results are or the laboratory test, as well as yung mga x-ray, CT scan, itra-translate lang yun sa code para kapag babayaran ng insurance, malalaman niya kung ano yung mga ginawa sa'yo na related sa sakit mo. So, yun nga, parang sa isang diretsahang salita, medical coding, para lang mabayaran yung ospital, yung institution, yung clinic, yung doctor, or medical practitioner ng insurance. So, si insurance, pwedeng private insurance or si government insurance. So, just like here in UAE, we have your Daman and other insurance na government ang may handle. So, this is an example of how medical coding is applied into practice. So this one, it is a radiology chart or parang this is a record kung anong ginawa sa'yo. So pag sinabi mo mga radiology, usually ginagamitan niya ng mga x-ray, ng CT scan, at kung ano-ano pa. So for this one, example, na-admit yung pasyente. RT means right. So, yan ay isa sa mga abbreviation na matututunan natin. So, meron daw pain or may sakit na nararamdaman yung pasyente sa kanyang kanang bahagi ng katawan. So, ang working diagnosis, syempre, ang gagamitin nila yung sinabi ng pasyente na masakit ang kanyang kanang bahagi. So, ang ginawa sa kanya, siya ay nagkaroon ng CT scan. Saan? Sa may bandang tiyan at sa kanyang may pelvis. So, abdomen, yan ang ating area ng stomach or sa may bahagi ng tiyan. And ang ating pelvis, yan ay bahagi ng ating, sasabi mong sa may likod, sa may bandang bewang. So, kung ganito kahaba, ito yung mga binibigay na dokumento sa pasyente or sa kamag-anak ng pasyente para alam mo na ito yung ginawa sa'yo at kung magpapakonsulta ka sa ibang doktor, may represent mo to. Pero in the end, ang mahalaga lang sa atin is ito. So, kung makikita mo sa bottom part, you have your ICD. Your ICD are composed of numbers. So, these are the old version kasi numbers lang siya. So, yung ICD na yan, dinedefine niya yung klase ng pain or diagnosis. Ano ba yung sakit na na-discover sa pasyente? Your ICD stands for your International Classification of Disease. So all over the world, pag sinabi mong 562.10 or 591 or 4.3.9, maiintindihan yan ng lahat ng medical practitioner at ng medical coders to be related to your right side pain. Meron naman ditong code, CPT. Your CPT stands for Current Procedural Term. Dinidescribe naman niya kung ano yung ginawa sa'yo. Ito ba ay laboratory exam? Ito ba ay operation? Ito ba ay pagbibigay ng gamot? Ito ba ay pagbibigay ng medical knowledge or medical consultation by doctors? But in this case, dahil siya ay nagkaroon ng CT scan sa kanyang abdomen at sa kanyang pelvis, na two contrast, ito yung codes dyan. So, sa mga bago, sa mga walang idea about medical coding, kumbaga parang mahirap intindihin to. Paano itong pagkahaba-haba na to, hindi mo na nga siya maintindihan kasi hindi ka naman medically inclined, wala ka naman training sa medical background or medical profession. Tapos biglang naging codes na lang siya, which is ito yung mag-a-appear sa exam. Well, ang solution dyan would be, the exam kasi, may kodigo tayo. So, we don't really rely on our basic knowledge lang or our understanding regarding terminologies or health and illness or diseases. Kasi, meron tayong ginagamit na books na mag-a-assist sa atin para siyang dictionary kung saan lahat ng mga codes na ito makikita natin. At yun ang i-discuss natin. Doon ang paghahasain natin kasi sa trabaho naman, ganoon din naman ang gagawin natin. Hahanapin lang natin kung ano yung sakit, ano yung ginawa ng doktor, tapos i-translate natin sa codes. So, hindi tayo talaga magfo-focus na maging bihasa para maging kasing galing ng nurse or kasing galing ng mga doktor na punong-puno ng medical knowledge kasi meron tayo dyang technique. So, bakit? Para saan ang medical coders? Here in UAE and as well as all over the world, there's a high demand for medical coders because hindi kikita or hindi magkakapera ang mga ospital kung hindi nila may translate yung mga naging serbisyo nila, yung mga naging services nila sa pasyente, whether inpatient, meaning na-confine, outpatient, meaning nagpa-consulta lang or hindi na-confine, pati yung mga consultations nila. So, dentista, doktor sa ospital, sirohano or surgeon, even mga psychologists. Basta kapag meron silang ginawang service sa pasyente at covered ng insurance, babayaran sila ng insurance. Kaya ang medical coders is talagang in demand in the medical and health system. So, ospital, clinic, private companies, kahit minsan, kahit sa insurance company mismo, kailangan nila ng medical coder. Kasi, bago sila magbayad, kailangan i-confirm nila na tama yung mga codes at tama yung naging proseso ng babayaran nila. So, yun ang reason para mabawasan na yung mga mahahabang binabasa, mga papel-papel, ma-convert lang siya sa code, saka mas madali siyang i-monitor sa system o sa computer. So, for this one, the medical codes, it can be, sabi ko nga, patient diagnosis, ano yung naging sakit ng pasyente, and then ano yung mga ginawa sa kanya na treatment, i-code yan. And of course, pati yung mga definition, classification, kung ano, kung bakit nagpunta sa ospital ng pasyente or sa clinic or bakit siya kumonsulta sa isang medical practitioner. Kasama dyan na kino-codes natin. For example, yung isang pasyente ay nalunod. So, syempre, di ba, para ma-save siya, dinadala minsan yung mga nalulunod sa ospital. Tapos nagkakaroon doon ng cardiopulmonary resuscitation. So, for that scenario, aside sa ginawa ng mga doktor at nurse na nag-CPR, hinok sa ECG machine, minonitor kung pumipintig pa ba ang puso, kung na-revive ba nila, i-code mo din dyan yung reason bakit siya pumunta sa ospital. So, kasama dyan is, kailangan ma-identify mo kung ano yung tamang codes sa kadahilanan na nalunod siya. So, yun yung mga unusual circumstances or medical condition. Now, this is for the AAPC. So, ito yung mga iba't ibang mga terms na maaaral natin. So, sabi ko nga sa'yo kanina, meron tayong current procedural terminology. So, lahat ng klase ng operasyon, maging major man yan, minor, or mga basic. So, kahit yung mga simpleng pagtatahi ng sugat, simpleng paglilinis ng sugat, ayan, kasama siya kasi proseso siya, procedure. So, isa to sa mga pinakamahalaga na kailangan nating pagtuunan ng pansin. Ito ay ang CPT codes. Then you have naman your ICD-10, International Classification of Disease. Ito na yung pagbibigay ng codes sa bawat diagnosis or kung ano yung pangalan ng sakit na na-encounter natin or sinabi ng doktor. You also have your HCPCS or your HCPCS, yung Healthcare Procedural Coding System. Ito naman, yung mga codes na hindi mo mahahanap na naka-under sa CPT. So, usually kasama to sa mga supplies or sa mga gadgets or sa mga iba pang mga ginamit. For example, kailangan ng wheelchair ng pasyente. So, hindi mo mahahanap ang wheelchair sa procedure codes kasi hindi naman siya operasyon, hindi naman siya process. So, makikita mo siya sa HCPCS. So, gumamit ka ng alcohol, gumamit ka ng gasa, gumamit ka ng karayom, ng sinulid, ng knife para sa operation, dito mo siya mahahanap sa HCPCS level 2. You also have modifiers. So, these are usually 2-digit numbers na nagbibigay ng another definition sa mga codes mo. So, example ng mga modifiers would be kapag ginamitan ng anesthesia, meron siyang sariling modifier. Kapag sa age naman, may modifier para sa mga bata na 0 to 5 years old at meron ding modifier para sa mga matatanda na 60 years old pataas. Meron ding mga modifier tungkol sa place. So, for example, nangyari ba siya sa school, sa work, sa bahay, sa labas. So, these are all codes na magbibigay ng another characteristic or meaning dun sa kinocode natin. So, to be a medical coder or a medical biller, medical coder, ikaw lang yung magta-translate ng mga codes. I-input mo sa system. Medical biller, yung mga na-translate na codes ni coder, ipapasok mo na sa system para mabayaran. So, i-identify mo kung magkano yung codes na to para sa sakit, magkano para sa supply, or magkano para sa naging procedure. So, tatandaan natin, tatlo lang yung focus natin generally sa exam. You have your CPT, you have your ICD, and you have your HCPCS level 2 code, which is na-define na natin earlier. And don't worry, because sa exam, bawat isang codes na to, may sarili siyang libro. So, meron ka magiging sariling reference. So, hahanapin mo lang yung mga choices, babasahin mo yung definition, titingnan mo kung yung hinahanap sa tanong ay tugma dun sa codes na nasa choices. Okay? So, ang medical coder at medical biller, pwedeng magkaibang tao sila. Or kapag sa mga ibang kumpanya naman, same person. Kasi in a way, related naman yung trabaho nila. But ideally, and sa US at sa iba pang malalaking bansa, magkaiba sila ng trabaho at mas magkaiba din sila ng sweldo. Because usually, mas mataas ang sweldo ng medical biller. So, paano daw ginagawa ang pag-medical codes? So, sabi ko nga sa'yo, from the paperwork or the medical documents, like mga medical reports, mga operative notes, so, yun ay mga kundi handwritten ng doktor, naka-print, binibigay ng ospital. Especially kapag na-confine ka, tapos lumabas ka na ng ospital, may tinatawag doon ng mga discharge summary or hospital records, medical records, kung saan naka-narrate or nandun lahat kung ano yung ginawa sa'yo sa laboratorio or ano yung mga naging findings sa'yo ng doktor, ano yung mga naging sakit mo, at kung ano yung mga gagawin sa'yo after, kasama yung sa pag-recover mo. So from that narrative, ibinibigay yung papel na yon sa mga medical coder, then they will identify kung ano yung mga eco-codes nila using the ICD-10 and using the CPT code. Wait lang, I need to reply. Yes, hello to the other participants of this course for the medical coding. Yes, I would just like to acknowledge that we have here on our class Mark John Melehor.
Sorry na late konti.
Okay, it's okay. We also have Sir Ariel, and we have Nieves Maricris Anas. Okay. Do you guys all hear me?
Yeah.
Okay. So I think I will be changing the language or the medium of instruction for this course because I was informed that we have other participant in this course that uses English for communication. Okay, so if you
We
just
have
have
other nationality.
yes, so if you just have questions or queries, um, just raise your hand and I will accommodate your concern. So as I have been discussing for the past half hour, so our medical coding course comprises of 6 weeks. And this is your week one, I'm sorry, this is your level one.
Yes,
So
ma'am.
in level one, we'll be talking about the medical coding as it is. We will define what's medical coding, what are the opportunities for a medical coder, as well as how do you get your certification for the medical coding exam. That is the topic for week one of level one. And for the remaining 5 weeks, we will be enhancing our skills in identifying and understanding the meaning of basic medical terminologies, especially the names of diseases or illnesses, as well as the name of your body parts using its medical names or its scientific name. Why? Because understanding these medical terminologies is very helpful for us to understand the scenarios or to give us a visual presentation of what's written, especially when we will take our exam. This will all be narrative scenarios. And if we don't understand what's happening or what's written, if we cannot visualize what are the words or what are the medical terminologies or anatomical names of what's written in the exam, then we may get confused in choosing the right codes or identifying the correct choice in the examination. So we have just discussed what a medical coding job description is. So in a, in a basic parlance or basic explanation, a medical coder is a person who translate the information, especially the medical information out of medical records, may it be laboratory results, may it be operative notes, medical records, discharge summary, anything that you get as a proof of your medical consultation or hospitalization, you will translate it into codes using letters and using numbers. So for example, you were confined because you have high blood pressure. We all know that high blood pressure, the appropriate medical term for those people having a high blood pressure is hypertension or
Hypertension.
hypertensive. So instead of encoding in the system the medical term hypertension, you will just have to code it using letters and numbers. So for hypertension, the code is I 0.9 to such like that. For example, your coronavirus or your COVID, the medical term that you will find in the reports or even in the notes of the doctors or the nurses would be your coronavirus or your COVID. But as a medical coder, there's a new code for that matter. And that's the one that you will input in the system because a medical coder wants to centralize the information, makes it easier to be understood by everyone all over the world, especially in terms of your claim, in your billing, in your insurance, so that the insurance can pay the medical practitioner or the hospital for the services that they have provided for the patients. So for medical coding, we rely on the codes in translating your medical diagnosis, which is the name of the disease, into codes using your ICD-10. Your ICD-10 stands for International Classification of Diseases version 10. So these are for your rheumatic heart disease, obesity, pneumonia, dengue, encephalitis. So anything that has to do with the names of the health situation, your illness, your disease, it's going to be on the ICD-10. Now, how about for your procedures? If you went for operation, for females, if you went into giving birth, so your codes would now fall under your CPT. CPT stands for Current Procedural Terminology. Anything that has to do with operation, process, even just like your consultation, going to the dentist, having a facial, or buying medications, those codes would be found on your CPT. Now, the skills you need to become a medical coder, especially if you do not have the medical background or medical training for it. So, for example, sorry, I haven't introduced myself to those who just joined the conversation or the meeting. By the way, I'm Sir Mark de Guzman. I'm a certified professional coder. I took my certification exam here in UAE last year. So for my bachelor's degree or for my training, I am a registered nurse from my home country, which is the Philippines. And I had experience in coding during my work as a medical insurance and dealer in a private hospital. So in the Philippines, we have a government insurance, which is PhilHealth, and that's what my task is all about. For PhilHealth or the government insurance to pay the hospital I was working before with in terms of the services they provided. So I would say that I'm very comfortable and well versed in the medical coding skills because I have the medical knowledge in terms of medical terminology, and I have the practice of translating the medical terms, the types of operations and procedures into using the ICD-10 and CPT codes. So for you guys, what you really need to develop or learn on this course is how medical coding works for beginners, especially those who do not have the background in medical billing or even the medical terminologies. So the skills that you need to do to develop would be first is your familiarization with ICD-10. ICD-10, it has a book that is alphabetically listed depending on the alphabets that we're using to identify the code. So if you are well versed in using a dictionary, basically ICD-10 is just like that. If there's a medical term that starts with the letter A, B, C, and so on and so forth, you just need to check that letter and then find the term under that letter. And then it will give you a translation of codes, which is, I'll give an example on the later part of this slide. As a medical coder also, or as a medical biller, you also need to know the process of billing. So how these codes are interpreted or being input on the system. Because sometimes there are codes that have special guidelines in them, especially if you deal with your procedures. There are procedures that you need to code depending on the size, the length, or the weight of the mass or the procedure done in terms of your operation. How many sutures, how long is the wound, how big the mass, the tumor was removed. So you can code that using variables or other factors. Also, some codes are used in as joiners to other codes. So, for example, you have a burn patient. Now, if that patient went to the emergency room or in the hospital, of course, the doctor will have to clean the burned part. So, together with the cleaning, you have to remove certain part of the body, may it be the skin, the hair, the nails, or the debris. So in coding, it's not just you will code the reason why the patient went into the hospital. You will also code the procedures as well as the supplies that you did. So for example, for a burn treatment, you will have a package for that. Then you will just use a specific code for that particular encounter. So you cover your ICD-10 and you also cover your CPT-9. You also need to understand what's the difference between an inpatient coding and an outpatient coding. So inpatient coding are used for those who are hospitalized, especially those who are confined or who needs to stay in the hospital for observation, for treatment, or for diagnostic exams, laboratory procedures, which entails 24 hours and above. While outpatient coding, these are just procedures or consultations that can happen in a hospital, in a clinic, or in a private office of your doctor, your dentist, which is does not entails staying longer in the facility or being confined. ICD-9 also, in some parts of the world, they are still using your ICD-9. So basically, it's still translating the medical terminologies, the diagnosis or procedures into codes, but relying on numbers. These are purely codes using numbers. So as ICD-10 was implemented, the countries all over the world, with the guidance of the World Health Organization, would like to systematize and centralize the medical information statistics. So they have a target that all over the world, those who are using ICD-9 should convert to ICD-10. Here in UAE, we are using already ICD-10, but there are still facilities who still have medical records or their system is appropriate for ICD-9, so you have to convert that. For HCPCS, HICPICS, these are the codes for your supplies, for your equipments, for your gadgets. So especially in the hospital, you use your syringe, your gauze, you use your surgical blade, your alcohol, even medicines. So whatever is given or whatever is used in the consultation, in the hospitalization or operation of the patient, those materials can be found on your